Hi, Mr. John. This is Celeste, your nurse, and it looks like you are now going to be ready to go home now. But before you go home, there's just a couple things that we have to discuss. So, firstly, we're going to discuss your diagnosis. So, when you came into the hospital, you were complaining of cough and phlegm. So, we took some chest x-rays and we found fluid in your lung sacs, and we also took some blood, and what we found in your blood is it was most of it was within normal limits. The only thing was your white blood count that was slightly elevated, still within range, but when we see elevated white blood cell count elevated but still within normal range, that could mean infection. And so with everything discussed, the doctor determined that you had pneumonia. And pneumonia is infection that inflames the air sacs in the lungs and they start to fill with fluid. This looks like you might have acquired it through the community. So what that means is you didn't get this pneumonia here, it was somewhere out in the world or through your community. So what could have caused this? I see in your chart that you're not vaccinated, which could increase your risk of having pneumonia. Living conditions as well. I see that you came from a homeless shelter, and sometimes either other people might not take care of themselves or you might not take care of your hygiene. So if you know other people are sick and you're around other people, that could increase your risk of getting pneumonia, as well as smoking. I see that you have half a pack every day, and smoking is very irritating to the lungs. It causes an increase of secretion, and it's easier for bacteria or viruses to kind of get into the lungs and stay there. And with the increased secretions, increased mucus, it's harder to expel all of that out. So with that being said, the plan for you when you leave is we have arranged you to go back to your homeless shelter, and then but with that being said, we also are going to need a follow-up chest x-ray in a week, just to make sure that with the antibiotics that we're going to give you, which I will discuss in a second, you know, it's getting everything out and the infection is coming out. We are also going to need to follow up with a doctor in 3 days or as needed. I know with your living conditions, it might be a little bit more difficult, so I have some information, and I have set up transportation or ways to get to the doctor and clinic. And then going back to your antibiotics, so you have a regimen of 7 days of an oral antibiotic, and it is very important that you follow this regimen. Before, you were getting IV antibiotic, which was through the IV site on your arm, but now since you're going home, we're going to switch you to oral. So it is very important that you follow up the whole regimen. Even if on day 3 you start feeling better, it's important that you keep taking the medication, because if you stop, the bacteria can become resistant and come back. So follow the full course. And then I would also advise you to drink a lot of fluids that will make the mucus a little thinner and easier to excrete. It's important to keep your lungs mobile and expanded. If you are in bed, you know, the fluid just kind of pools in the sacs and just makes the condition worse. So it's important to move around, be active. You will be going home with an incentive spirometer, which I will show you how to use in a second. But yeah, just keep being active, keep making a lot of movements, deep breathing to, you know, get your lungs to expand. And so with that being said, with the incentive spirometer, so how you are going to use that. So this is the incentive spirometer. So this is the mouthpiece that it goes with it. And then, so what you're gonna do is you're gonna take the mouthpiece and then you're gonna put it in your mouth, like close your lips with it. And once you close your lips with it, what you're gonna do is you're gonna start inhaling very slowly and take a deep breath with your mouth being closed still on the mouthpiece. And what you're gonna see is that you're gonna see this white kind of flat thing kind of go up, and that's just telling you how much air you're getting in your lungs. So the goal is to get it as high as you can. You know, you don't want it to be on the lower end. That doesn't mean that you're deep breathing well enough. So you want to keep going up as much as you can. And then also this yellow indicator is going to tell you, you know, how good are you doing. If you're up at the best, like you want to keep it right here in between the best and good when you inhale. And so once you're all the way inhaled, then you can hold for 5 seconds and then you slowly just breathe out on the mouthpiece. So this is going to go home with you. It's important that you do this every 2 hours while you're awake. So just do this 2 times every hour when you're awake. And this, like I said, is going to help those your lungs open up, air sacs open up, and just get all the mucus and phlegm out. And then one last thing before you leave, I will be giving you a vaccine for pneumonia. So do you prefer which side you want the vaccine? On your right side? Okay, so how we are going to do this, so I'm gonna do some hand hygiene first. And then we're gonna put on some gloves. So I already have the vaccine here, or your shot here. So this vaccine is going to be on your arm, on your right deltoid. So to map it, you find the acromion process, so the bony part of your top shoulder here, 2 fingers, and then you go to the axillary line. You kind of make a line here, and then you make a V right at the axillary line. And kind of in the middle is the sweet spot. So once I have already mapped, I'm gonna get my vaccine. This is an IM injection, so it's a 90-degree angle. So you're gonna feel a poke in 1, 2, 3. Poke. And then release. And then I'm gonna patch it up. I don't have tape right now, but I'm gonna patch it up with tape. And I would have cleansed the area first, but there's your tape. And then looks like you're all ready to go. I'm gonna give you the package here. It's in English, but I also know that your second language is Mandarin, so I also printed out a copy in Mandarin. So yeah, if you have any questions, just let me know. You're not leaving just yet, just in a few minutes here, so any last minute things that you think about when you're discharging, just let me know. But I'll leave this with you, and I hope you get better.